can count on.
Welcome back on this Wednesday. As the weather continues to warm up this spring, many of us will find ourselves getting more and more active outside. Can't wait.
Yes, I can't wait either, but for those with asthma, all that activity can be a real problem. Joining us today is Dr. Jonathan Bayuk from Allergy and Immunology Associates of New England. Thank you so much for being here.
Thanks for having me.
And can we just talk the basics here? What is asthma?
So asthma is predominantly an allergic disease that has to do with airway constriction and mucus production in your lungs. So what happens is, whether it be from an allergen or whether it be from an infection or another trigger like exercise, the airways can get tight and you can make some mucus, and it makes inside your lungs, it makes it very difficult to breathe, and coughing and wheezing and other problems like that.
And you kind of addressed it, but I was going to ask, is it an allergy? I know for me, when I'm outside exerting myself, exercising, running, even shoveling the driveway with snow, my lungs close up with allergy. It's exercise-induced, but there are different triggers for everyone, aren't there?
There are. I mean, the common ones are allergy, so springtime, fall time, or if you're around pets, or if there's a real dusty environment, if you're allergic to that. But also, exercise can be a trigger. Viruses are a very common trigger, especially in children. And so those are the things that you would expect to see in those different times of the year when infections go up or during the spring and fall.
Who's typically affected by this?
So there's about 9% of Massachusetts residents have asthma, so it's a huge problem.
Wow.
We see patients every day in our practice at Allergy and Immunology Associates of New England, and the process of going through that is pretty straightforward. But it can be anybody. People who are allergic are obviously going to be the top of the list, and that's between 25 and 30% of us in the U.S. And so it can be anybody, but children are affected earlier, obviously, but adults can come down with asthma as well, so it's just a process.
It can just happen any time in life.
It can,
How do you diagnose something like that?
So the diagnosis is done through history, of course, and then there are some testing that goes on with spirometry, which has to do with a breathing test, physical exam, and allergy testing, if indicated, which it often is. At that point, then you figure out the severity of the asthma based on very good guidelines, and then you treat them.
Now, this isn't something you should self-diagnose. This is something that you go to a doctor for to be treated.
Absolutely. And actually, right now, there's some controversy in this country about allowing some asthma medicines to go over the counter, which can be very dangerous if you don't know what you're doing, because the medicines are very effective, but they do have side effects if they're not done under supervision.
And how exactly is it treated? I have to use a rescue inhaler from time to time, and we were talking before the segment. You said, well, come see me, I can fix that.
Yep.
I'd rather not have to use it, because at that point, my asthma's already flared up. I like it so it doesn't even occur. Yeah,
you make a great point, and that really is the point about asthma, is that if it's not controlled, and the control has to do with not using albuterol, which is one of the rescue medicines that you're talking about, more than twice a week, not waking up more than twice a month, and not having any exercise limitations, and we can do that in 99.9% of the cases. So, what the goal is to have people basically symptom-free. And the way you do that is through controller medicine, through evaluation of allergies, treated with immunotherapy, which is allergy shots. And there's some other medicines that aren't inhalers that also can work very well. So it can really be taken care of very effectively almost all the time.
All these years I've been suffering.
I'll fix you. Now you met the right guy.
I need fixing.
I'll fix you.
And I mean, what are you seeing now? Are you having a lot of patients come in with these allergy issues or asthma issues starting to come up? Does it matter, this time of year?
Yeah, for us, we're pretty much busy year-round because there's perennial allergens, which are year-round allergens like pets and mold and dust mites. Right now, we are seeing early tree pollen, and I think in the last segment a few weeks ago, Dr. Robertson was talking about how we're seeing more and more pollen earlier and the seasons are longer, and that's very true. So right now, people are starting to itch their eyes and get stuffy. That's why.
That's the truth. Dr. Jonathan Bayuk, thank you so much for your time.
Thank you, sir.
Thank you.
Great information this week, as always.
Thank you.
And Dan Brown will be back right after the break.